Okay, good morning, everyone. I think we're ready to begin this morning. This is one in a series of PHMSA's speaker bureaus. It's an opportunity for us to hear from some of our thought leaders on important issues related to our mission. We are very, very happy this morning to have with us Dr. David Michaels, who is the Assistant Secretary at the Department of Labor's in charge of occupational safe and health. Dr. Michaels was confirmed in December of 2009 by President Obama. He is, by way of background, an epidemiologist who is currently on leave from his position as Professor of Environmental and Occupational Health at George Washington University School of Public Health. He's an author of many, many studies examining the health of construction workers, printers, bus drivers, and other occupations, as well as of numerous other publications of science and regulatory policy. He's also an award winner, many different awards. Before going to OSHA, I believe that he was in a prior administration Assistant Secretary at the Department of Energy for Environmental Safety and Health. We've asked him this morning to talk to us about anything he could possibly imagine related to regulatory issues. We have been working with OSHA over the past year. Last year, I believe they put together a workshop with many different organizations across government to talk about performance-based management, something that we are all familiar with here. We have been working with him on safety management systems. You should know Dr. Michaels has been talking internally with our senior management team about creating an understanding and agreement about what our enforcement policy should be here, a common, shall we say, prayer book for all of us to talk from, and we look forward to your comments on those and any other matters you'd like to share with us. For those in the audience, you should know Dr. Michaels is going to speak, and then we're going to stop recording, which we're doing for everyone in the organization, and he has agreed to take questions. Dr. Michaels.
Great. Thank you so much. Can you hear me without this mic? Great. It really is an honor to be here. When Administrator Quaterman and Deputy Administrator Weiss asked me to come, I was very pleased with the invitation because OSHA and PHMSA face many of the same challenges. In addition to working together, we've been able to work out, I think, a very good relationship, looking at how our regulatory authority meshes with yours. And certainly there are many instances where we're on the same site thinking together, and we need to do that efficiently and effectively. And the most obvious example right now is the West Texas fertilizer explosion, where we have people on site, and you have some folks down there. We do need to be working together, and we are very similar in a lot of ways. So what I want to do is talk about how we think at OSHA about what are challenges and ways to approach those challenges. And I'm eager to hear from you also how you address some of these same issues. I'm eager to learn as well as to talk. So I'm going to go through my slides here. And if you have any questions while I'm doing it, though, just put your hand up. Let's make it sort of informal here. So our agency is 42 years old now. In sort of one of the earlier periods of bipartisanship, Congress passed the OSHA law. President Nixon signed it, and behind him at the signing ceremony was the presidents of the AFL-CIO and the Chamber of Commerce. We look back wistfully at those days. Everybody sort of agreed that with what President Nixon said, that for the standpoint of, at that time, 55 million people covered by it, maybe one of the most important pieces of legislation passed by Congress. We take it for granted now that that workers in the United States have the right to a safe workplace, but before 1971, that was not the case. And workers in many states had no rights at all. If you were told to do a dangerous job, you had two choices: do the job or take whatever consequence you had for essentially being assigned a task that could threaten your life. So we're in a much better place now. The OSHA Act, to me, is very simple. The law says to us, First of all, it's up to the employer to provide a safe workplace. We look at the establishment and the employer, and that's their job. We don't have any responsibility over workers to say, workers have to do specific things. Our job, we look at employers because employers have the obligation under the law to provide a workplace free of recognized hazards, and our job is to ensure that employers follow the law. So that's how I sort of, boil it down. If you have to stand on one foot, explain the OSHA law while you're standing on one foot, that's how I explain it. Our charge, though, our mission, is huge. I tell everyone we do everything from nail guns to nail salons. And it's really true that we cover 130 or so million workers in the United States, 7 or 8 million workplaces. We don't cover mines. That's our sister agency, the Mine Safety and Health Administration. There are certain categories of workers who are preempted by other agencies. Truck drivers, for example, are covered by a DOT agency. Certain activities in railroad are covered by a DOT agency. The Department of Energy, where I used to work, doesn't let OSHA in the nuclear weapons plants. It's self-regulating. I was the regulator. But for the most part, and we don't cover certain public sector workers in some states. It's complicated. But for the most part, we cover American workers, 130 million, as I said, in all sorts of workplaces. And of course, we have to do that in many languages, because every worker in the United States has the right to a safe workplace. And just because they don't speak English, that doesn't mean they don't have the right to a safe workplace. So we have to think about those issues as we do this work and look at who the workers are in the United States. So we have materials, as you can see, in Spanish and Vietnamese and many other languages as well. We have to do this with relatively fewer inspectors. The halcyon years of OSHA were the late 1970s. With our state partners in 21 states, actually the states administer the OSHA law. We had about 36 inspectors for every million workers covered. The 2007, it dipped below 20. We're now up at about 22, 23, but obviously far less than we were. What that means, and you could see this in the paper now, a lot of discussion around West Fertilizer, is we can get to every workplace in the United States more or less once every 100 years. Now, on one level, that's a useful statistic. We don't go to most workplaces, and there's no reason to go to many workplaces, but even hazardous workplaces, we can't get to all of them. And you could double or triple or quadruple our budget, but you could see we're still not going to get to all of them on a regular basis. And there are facilities that if we made the visit on one day, they could still have a major explosion a week later, and we wouldn't have seen the cause. So the idea that we can inspect our way out of, into safety is an important one to remember. We can't. There's no way to get there. We obviously need inspectors, and inspections have a very important role in changing employer behavior, but it's not the only component of it, and that's what we have to think about. So how do we do that? I think to some extent we've been successful, and I certainly don't take, OSHA doesn't take credit for this. The fatality rate has dropped since OSHA began. It was dropping before that. Part of it's the change in mix in industry in the United States, but a lot of industries that are quite dangerous, like railroads, haven't left, but the injury rate, the fatality rate is way down. And it's been really a cooperative effort with employers, unions, professionals, federal and state government have had a big impact. There's no question. When OSHA was founded, there were 37 deaths every day in the American workplace. We're now down to 13 every day with a workforce that's twice as large. It's 13 too many, but we're making progress. But there are still 4,000 Americans who die on the job every year. Yesterday, actually, the Bureau of Labor Statistics put out their numbers for 2011. It's about 4,600 died in 2011. We don't know how many workers die or are sickened from exposure to chemicals and other dangerous substances or agents in the workplace, because it's very difficult to track that. Many are not diagnosed, but estimates by the National Cancer Institute and the National Institute for Occupational Safety and Health, which is our sister agency, it's the research agency that's in HHS, but created by the same law, estimate about 50,000 workers die every year from workplace exposures. But these are old workplace exposures. Obviously, they're not ones that are occurring now, but from asbestos and silica and things that occurred a long time ago. But there still are significant workplace exposures out there. We know that at least 3 million workers are injured every year on the job. And we know that because employers record that on their, what we call their OSHA log, which every private sector employer in the United States has to, well, not everyone, but in most industries, and certainly high hazard industries, employers record that information. The Bureau of Labor Statistics takes a sample of it, and this is their estimate. But they now will tell you that they actually capture between 40 and 70% of all injuries. So they know this is a very significant undercount because many injuries are not recorded, but they're seen in emergency rooms, they're seen in workers' compensation systems. So it could be 4 or 5 million workers are injured every year on the job. And the cost is huge. There are a lot of ways to count it. I don't know if this is the best number, but there are a lot, it's high. The other mission of OSHA, other than preventing injuries and illnesses, is to make sure that employers who do the right thing are not at a financial disadvantage competing with employers who don't. We think everybody should be on the same playing field. And we point out that when we issue a fine against an employer who is a scofflaw, that helps ensure that that scofflaw isn't able to sort of outcompete employers who do the right thing, all other things being equal. So how do we think about this? And we think about, I mean, we call it deterrence theory. There are lots of things you could call it. But when we think about what we do and why we do it, and we put everything through this prism, essentially, we think about, we have a whole range of different strategies. What we want to do is change employer behavior before workers get injured. Before we inspect, in fact, is when we like to change it without us inspecting, because we can't inspect everywhere. So we have the law and our imagination, our creativity, gives us a whole bunch of tools. And our attorneys are very helpful in figuring out can we use them or not. But we have a lot of different tools for different situations. And my job is in this environment of limited resources, what's the mix? Which tools are applied where to be most effective in reducing the injury and illness toll across the United States? So this is, my background's in epidemiology. I used to teach statistics. So I think in terms of normal distributions. So I think, first of all, if we're thinking about employers, what's the distribution of employers in terms of their commitment to workplace safety? And not surprisingly, I expect, though I don't know this for sure, but that there's some sort of normal distribution. There are employers on the right side who are terrific and others who are not. For the great employers, and there are many employers who understand workplace safety, and they don't look at OSHA they don't have what we call a compliance culture. They're not interested in thinking about, are we meeting OSHA standards? They're interested in having a culture of safety in their workplace. And there are companies like Alcoa. You could talk to Paul O'Neill, who was CEO of Alcoa, and he's been interviewed about this, and there's a book written about this, that safety isn't a priority. Safety is a precondition. If you go to the Alcoa website, on their website, right on the front, is a real-time injury reporting system that everybody sees and their CEO sees every morning. For companies like that, we have what we call recognition programs. We pat them on the back, we give them a flag, we say you're great. We say you're not going to get inspected because why waste our inspection time there? So we call that's a recognition program. We have one for large employers, we have one for small employers. There are a few thousand employers in that program, and they're zealots, and they get it. And they help us proselytize. They talk about safety to other employers. Sir?
I had a question. When I interned with you guys a few years ago in grad school in Wisconsin, and there were only a few area offices that were VPP. Have you guys expanded it?
Oh, yeah, actually, right. We are actually focusing on we expect our own people to have the same commitment, because we do some dangerous jobs as well. So in that region 5, my understanding is every area office is VPP, and there are areas like that. But that's a good point. I mean, we try to, if we're going to talk the talk, we try to walk the walk as well. And was your office was one?
Madison.
Yeah, and they were.
They just got it right when I was there.
And it's a lot of work, and we have the bar pretty high. Yes.
How did you convince leadership to take a risk like that? Because if you deem an entity as part of a recognition program, meaning that they're great, obviously they're going to have an accident
And they
at
do.
some point. What do you do in
That's a big issue. We've had fatalities. Every year we have fatalities, and we go back and look at them. We actually just are working on a new policy on that. There are sometimes fatalities occur that are unrelated to any sort of thing that could have been prevented, but that's a rare event or predicted. So if there's a fatality, we do an investigation. We will pull their VPPs, their voluntary protection program. We'll pull their certificate if based on our investigation. We try to have some due process involved, though. What we found, the reality is, what we found many of the fatalities are among contractors, and one of our requirements is that all of the company's requirements have to cascade down to everybody on the site, and that's a very important consideration. Anyway, so we have these recognition programs. The other end here are these companies that really have very little concern for their employers, and we get these just terribly, we call them egregious cases, where obviously there is no concern at all for the worker, for their life, for their hands and fingers, whatever it is. Employers have pulled guards from machines, and even though someone's had an amputation, they keep the guards off because you work more productively. And for these, we have criminal penalties. They're not very effective, frankly. The OSHA law is that if there's a willful violation and a fatality, it has to be a fatality, we can refer to the U.S. attorney, and the maximum penalty, anyone want to guess? If there's a fatality, it's a misdemeanor with 6 months in jail. And if you're a corporation, there's no jail time. There's a maximum of a $500,000 penalty. But we have great difficulty getting U.S. attorneys to take those cases because they're not very sexy. We had a case recently in Tennessee where a contractor lied about their injury rate so they could get a higher bonus from TVA. And we'll come back to this, but by intimidating workers so they couldn't report their injuries, they got a more than $1 million bonus. That manager got, I think, 76 months in jail. So there are other statutes that have far stronger penalties than the OSHA, and we think that's a weakness, and we'd love to see that changed. But most employers, though, are not in either of those tails. Like most distribution, I believe that they're more in the middle, and we know that there are many employers who would like to do the right thing but maybe don't know how. We deal with many small employers who may not have the resources, so we put plenty of resources into something called compliance assistance and consultation. Yes?
Far ends of the spectrum, the people that are in the little category or in the great
The
category.
tails, yes.
Have you found any commonalities about their industries or what puts them in those?
No, and here's the problem. We know who these are because they're in our programs. We don't know who these are until we see the problem. So I can't tell you much about who these people are. I wish I could. It would help us if we could profile them better, but we don't know that much about them. But we think there are a lot of employers who would like to do the right thing who just need help getting there. And we like to think that no employer should have hazards there just because they don't have the knowledge about it. So we really spend a lot of time on what we call compliance assistance and consultation. We have a program. People are often afraid to talk to OSHA. So we have a program where every state has what we call our consultation service, free consultation to small employers. We pay 90% of the cost, states pay 10%, and you get essentially an OSHA inspection without the citation. Many people don't know about that, but we try to encourage employers to do that. And of course, we do inspections. And we know, in fact, that if the fear of inspections moves people over to do the right thing. Though, of course, if they don't go over there, by the time we go in and inspect, if we find hazards, we issue citations. They have to abate those hazards, and we know that has an effect. And I'll get to that. I'd like to think maybe the normal distribution is more like this: that there are a lot more employers over here than over here. Obviously, we don't know. We don't collect information. Other agencies have requirements that many employers send in information. EPA can collect information about chemical hazards, for example, from every employer. We can't do that. So we guess, and I like to think, my optimistic view is this is the way the curve looks. But our job is to look at all of these categories and essentially move the curve. Every one of them, we just want to keep moving over to the right. And if we do a good job, we've impacted all of these different categories. One thing we do is we issue standards. And I know you do this as well. And this is, in some ways, the biggest impact. I think standards are game changers. And it's obviously very controversial now, and the question of issuing standards is a difficult process. When we go back and evaluate our standards, you can see the impact. You know, I started out working in a hospital in the Bronx. I worked my first 13 years of my work life. When I was working in a hospital, hepatitis B was a real risk to many hospital workers. And there were about, I think, 19,000 cases reported every year among hospital workers. OSHA issued a bloodborne pathogen standard in 1991, and then there was Congress actually strengthened that with the Needle Stick Safety and Prevention Act in 2001. Right now, the number of hepatitis B cases among healthcare workers is in the dozens every year rather than in the thousands or tens of thousands. And that's because we have regulations that say employers have to offer vaccines, they have to have sharps, they have to control for use of sharps. They make a big difference. And you take it for granted. I mean, now the idea, well, let me ask you a question. When was the last time someone here went to a dentist who wasn't wearing gloves? Well, when OSHA proposed in 1991, or actually before 1991, that dental employees, including dentists, had to wear gloves, we got tremendous pushback. I'm not going to be able to do my job if you make me wear gloves. And that was to protect the dental workers, not to protect the patient. But now no one would think about doing that job without gloves. But you take it for granted. Once OSHA issues a standard, people come around, they realize it makes sense, it's doable. And that's what we've always had. We have a standard on excavation and trenching. We lose a worker once a week in the United States in a trench collapse. And there's no reason for that. If you read Herodotus, the Phoenicians knew how to prevent trench collapses. Yet we still have people who dig trenches deep and not wide, who don't use trench boxes, and kill workers. The numbers have gone down since we issued a standard, but it still happens. So the interesting question right now in Washington is, there are some people who never use the word standards without saying job-killing standards or job-killing regulations. Yes?
I had a question. Are you guys, because I kind of follow the agency still, some of your major standards, like ergonomics, are you guys ever going to issue?
Well, let's hold on to questions like that. I mean, if you're asking something very specific, but we're going to have a long conversation afterwards. So let me do this. Yes.
Just a quick question
Yeah.
on the consultation.
Yes.
Do you have a firewall that if someone goes to a company and does a consultation visit, that you won't go back and report them?
Yes, we cannot. We have certain rules. One is we will not go in and do an inspection while the consultation process is going on. And that could take 6 months or a year or more. If at the end of the consultation process, the consultants have said, you really have to fix this, and people don't, then they will call us. That's the one thing we warn people of, that if you bring in the consultant and you have serious hazards, you have to abate them. And the consultant will tell you how to do it and help you get there. But you can't just do it for the information's sake and then not do it. But we will not go in there. They send us no information. It's quite confidential. So the question is, do standards kill jobs? That's the sort of debate. And there are lots of studies on this, on older standards. We haven't issued many standards in the last few years, so we can't look at new ones. But in 1974, a physician working for the B.F. Goodrich Company, unless it was Goodyear, I can't remember, I think it was Goodrich, in Louisville, Kentucky, reported 5 cases of a very rare cancer, angiosarcoma of the liver, all in workers who were exposed to a chemical called vinyl chloride, or vinyl chloride monomer, which is the chemical that's used to make polyvinyl chloride, or what's called vinyl, when you have vinyl shower curtains or vinyl sidings. So it's an important industrial chemical. OSHA was quite young, it was 1974, and proposed a standard to protect workers from vinyl chloride. The response to the chemical industry, and this was common at the time, and it's frankly still common, industry spokesman said the proposed standard was medically unnecessary, technologically unfeasible, and would lead to a loss of as many as 2.2 million jobs. Job-killing regulations. Fortunately, OSHA moved forward with the support of the president, that was Gerald Ford at the time, and issued a standard, 1 part reducing exposure, 1 part per million. And as far as I know, really preventing further cases. There are very few cases. There have been some cases subsequently, but no one who started exposure after that. And what was the effect on jobs? Well, this was in Chemical Week, less than 2 years later. PVC rolls out of jeopardy into jubilation. Essentially what happened is, and this happens over and over again, US engineers are the most innovative, creative, productive in the world. They figured out very quickly that you could control the vinyl chloride production process, save the feedstock. It actually, so they were losing a lot into the air. They could enclose it and make it more profitable. And not a single job was lost. It was absolutely a canard. And the vinyl chloride industry boomed after that. And as the cost of energy increased, they were in better shape because they had a more efficient process. I suspect we could say we actually saved jobs and increased profitability in the industry for that. And that's the case over and over again. The Office of Technology Assessment did a study of 8 OSHA regulations that were before the 1990s and showed that in 6 of them it was very clear it had no impact on jobs. OSHA always, it turns out, not only does industry overestimate the costs of our standards or our proposals, but so does OSHA, because we don't take into account the technology shift that is pushed by new standards. And standard setting is a very important part of the economy because it encourages employers to be more productive in many ways and to address problems. We have a very weak noise standard, and we don't enforce it. We actually have a policy not to enforce a lot of it. So we really have only extremely loud noises are addressed by OSHA standards. If you go to Europe, there's very strong hearing protection rules. The National Academy of Engineering just did a study and pointed out that if an employer here wants to buy quiet, and there's a whole movement to buy quiet machines, you have to go to Europe to buy those machines. Because we don't have strong standards, so US manufacturers don't produce quiet machines. If we had a stronger noise standard, we'd have machines here that are produced quietly, and it would save not just people's hearing, but we'd have newer, more efficient machines. So here's what I tell people. OSHA standards don't kill jobs. They stop jobs from killing workers. And there's lots of evidence of that, and though we have this debate every day when we talk about new standards. So what we do, the other thing we do, sort of in thinking about that curve, we do compliance assistance. And so we have this bottom one is this consultation program I told you about. We have a website with lots of information. We're always trying to put more things up, telling employers, get the information you need. We have an 800 number. We have what we call an e-correspondence system. We have people in every office who do outreach to employers to try to make sure that they know what changes they need to make before workers are hurt. We also do inspections, and there's a lot of talk, and if you read testimony in Capitol Hill, you talk about OSHA's, our increased enforcement policy. I've been pilloried in many places saying OSHA's really making enforcement, a very big issue, and we're taking this, we're really going after employers. So the 07, during the Bush years, we did 39,000 inspections. Now we do about 41,000. It's, in terms of the big picture, that's the same number. I mean, because we're talking about, well over 100 million workplaces. We don't do more inspections. We don't have the staff to do more inspections. Our staff is the same staff it was before, and actually, they were doing good inspections 5 years ago, and they're doing good inspections now. That doesn't change much. Actually, OSHA is is set up in a way that the field that does a lot of the work is really insulated from a lot of the political winds blowing in Washington in a very good way. But what we try to do is increase the impact of inspections. One thing is publicity. We know from many, many conversations that, maybe this is common sense, employers don't like to be in the newspaper being called a scofflaw. And not a year after I got to OSHA, I was at a meeting of the OSHA Review Commission, and one of the attorneys from who represents employers said, he gets calls from employers saying, how do I avoid being in a press release from OSHA? And he explained the best way to do that is abate your hazards. And that's what we want to do. Because if we only change the behavior of those workplaces we visit, we go to 40,000 a year. So we obviously, that's not successful, right? So how do you change the behavior of the employer next door or the next town over or in that same industry but across the country? You have to think about that. So press releases around inspection results and citations, very important. And we also issue press releases when companies get into the VPP as well, to, the good stuff. But the bad thing, employers read trade association journals, and we issue a citation against a company for X, Y, and Z, and we try to be specific about. We know that that's going to impact other employers, so it's a reason to do press, and that's the main reason, not to toot our own horn, but to get the information out that someone else in that industry just got hit by OSHA for that hazard. You should do something about it. We have something called the Severe Violators Enforcement Program, and those are companies which we found really terrible hazards, and they weren't doing the right things, often after someone's very badly hurt. And you put this in there, it tells employers we're going to come back, but also it says we're going to look at other facilities in your system. Now that doesn't impact construction employers much, but we can go to a manufacturer, a large, say, a manufacturer that is making containers in one place. If they have 4 other factories, we'll tell them at some point we're going to visit your other factories as well. And they're high on our priority list, and so that has an impact as well. Essentially, that one inspection hopefully is having some ripple effects. Corporate-wide settlements. When we see an employer with a hazard, in our settlement, what we'd like to do with them is say, let's deal with that hazard here as well as at all your facilities. We've been negotiating with the post office, for example, which is a difficult organization to negotiate with because they obviously have significant fiscal problems. But we've seen some arc flash issues that we think are very significant. In fact, we found them, I think we have more than 30 different inspections in different sites where we found the same problem. So we want to deal with that across the country. Let's have one discussion about it. Let's figure out what the solution is. And we're negotiating corporate-wide settlements, and we've done corporate-wide settlements with a lot of different companies, from companies that do muffler replacement that had problems with the lifts and workers could get hurt, saying, okay, if you're going to fix it, you're going to fix them in all of them. You're going to post the results of the settlement on the wall in every one of your facilities, and so we know we'll have a bigger impact that way. And well, that's what standards are for. The industry-wide, we have a few industry-wide partnerships and alliances, which are all voluntary. We have one with the refractory ceramic industry, for example, where they commit to keeping their exposures to far below our standard. But it's not something we could enforce, but they do it. I mean, and they come every year. They recognize they need to do it for many reasons, including liability reasons. But that we can't force these corporate-wide settlements, but many employers recognize that's the way to go. If we're going to go into one place and find it, then one of the tools we have is the repeat violation. And we look at repeat violations as being anywhere across the enterprise. We think of establishments, which is an individual work site, and an enterprise. So if we go into a well-known department store, let's say general store type, and we see problems with the trash compactor, and people have been killed in these compactors. And we see there are no guards, and the policy is that they let people go in there and stuff their hands in there. We will say to the employer in this case, the next time we see this at another site, at another facility, it becomes a repeat violation. And while our fines are quite low, $7,000 for a serious violation, the repeat is $70,000. And we'll tell them, we see this, if this is your policy, you better change it across the country. And we have that, one of our tools is repeat violation. And of course, it's also willful at that point. If we've told them, we've settled with them, it's wrong. So we're very interested in evaluation. And is what we're doing effective? Because if it's not effective, why are we doing it? It's very hard to measure the impact of an OSHA inspection. You could go into a workplace after we inspect and see, is the hazard gone? And that's effective. That's a useful evaluation. But everybody wants to see, is the injury rate down? And, this is true in public health. And if you're doing evaluation studies in general, right now when we look at smoking cessation programs, We don't evaluate on the basis of have we prevented lung cancer, because we know if you stop people from smoking, you're going to prevent lung cancer. So there are various things you measure in terms of have they stopped smoking. But we're still trying to figure out in workplace safety, have we actually prevented injuries from occurring? We can always document the fact that a hazard that we identified has been abated because we went there. But the question people really want to know is, have we reduced injuries? Have we prevented fatalities? Now, sometimes it's very clear that because there's a sort of temporal relationship between our intervention and an outcome and the prevented outcome. It's not unusual because if you put a guard back on a machine, it's hard to say, well, no one had their hand cut off for the next year, but it's a big study to try to figure that out. But sometimes there are these obvious cases that help us out. This was a trench this is outside Columbus. We got a call. Our office sent one of our inspectors, what we call a COSHO, Compliance, Safety, and Health Officer, to this trench from the Columbus office. Rick Burns was his name. He got there. He's told the foreman there were a couple of workers in here. He said, get these workers out of this trench immediately. You could see, based on what I told you before, this trench is deep and narrow. And this is exactly what we fear. He got the workers out of the trench, and 5 minutes later, the trench collapsed. So we know in this case, this was an effective intervention. It's anecdote, but we know it's effective. And that's sort of a rare event, but it happened a month later in Alabama, where there were workers underneath this excavator, and our assistant area director and the COSHA were out there and said, get these workers out from under there. And within minutes, it collapsed as well. But those are rare events. And there are two rare events. In this case, in Cincinnati, we actually went in and cited this employer 2 weeks earlier for trench violation, and he didn't listen. And 2 weeks later, that worker was pulled out of there, that body was pulled out of there 8 hours after that trench collapsed. Because that's often how long it takes to dig away all the tons of dirt. So we're not always effective, even when we make the intervention. So we know that, and that sort of tells us something about our work. But the good news is that there are a number of researchers unconnected to OSHA who are looking at the question of, is what we're doing effective? Now, you know that we test drugs using randomized clinical trials, right? That's sort of the gold standard. We say, okay, we're going to give this drug to people to see its effect, but we're going to randomly assign people to a group. They get the drug or not, right? And then we make the comparison. That's how the FDA decides whether a drug is effective. OSHA uses randomization to select where we have to visit. And that's because of a Supreme Court ruling in the 1980s that said that we can't arbitrarily go inspect any place we want. We have to have a reason to go. And if we're doing something with an industry, for example, if I think we should go into all fertilizer plants, which would be a difficult thing to do because we couldn't go to all 6,000 of them in the country. So we'd say, okay, if we're interested in fertilizer plants, we have to make a list of all the fertilizer plants in the universe we're looking at. If we're looking at Texas, then we have to have every fertilizer plant in Texas, and then we randomly decide where to go. We actually have a computer program that randomly generates our inspection list. So one can do a randomized study saying places we visited versus places we could have visited and didn't. And there are now researchers across the country looking at these, and we're providing lots of data because we want them to do it. We're not paying them. So there's a group connected with the RAND Corporation, which is a big research group, that looked at Pennsylvania inspections, comparing places we visited versus ones we could have visited, and they actually have Pennsylvania workers' compensation data, so they actually have outcome data. And what they showed was that there's a 10% reduction for the first 2 years after a program inspection. That's one of these inspections I talked about. If we issue a penalty. If we don't issue a penalty, there's no reduction in injuries. Now, that may be because there were no hazards for whatever reason, but if we actually issue a penalty, we could see that reduction for 2 years. In this study, the decrease, it leveled off after 2 years. But we also find that if we issue, it depends what type of penalty we issue has an impact. Some of our citations are specific to a piece of equipment. We might say, for example, that you have to, the machine guard isn't on that guard, or there's no lockout tagout system. they have an impact. But the bigger impact are citations that have, well, it's not clear on that, that say the employer has to assess their workplace. Like if we issue a standard citation for not having personal protective equipment, to do that, to abate that, you actually have to assess what your hazards are to figure out what the proper personal protective equipment is. It turns out violations of standards that require the employer to actually look at a problem and assess it have an impact and reduce injuries, not just in things related to the standard, but reduce injuries overall. And they actually reduce ergonomic injuries, back injuries, as well as things directly related to the safety issue, because it's engaged the employer in thinking about what's going on in the workplace. The best study of this type, I say the best because I like it the most, but it was also done by, don't try to read that, I'll summarize it for you. It was done by researchers. Most of the studies are done by epidemiologists, which I like because that's who I'm an epidemiologist. But there were some economists at Harvard and Berkeley in the business school decided to look at these same issues. We thought that would be very interesting. You know, they don't have the same bent. They're interested in its impact not just on workers, but on the employer. And so they went to California. They looked at our randomized. They looked at high hazard employers who got OSHA inspections versus high hazard employers who could have been inspected but didn't. They were on the list, but you know, they weren't chosen. And what they found was, and they were also able to get all sorts of information about not just whether workers were injured, but also about the health of the company, because they're business school professors. And they published this in Science magazine, which is peer review, quite prestigious. They showed that injuries, for the next 4 years after our inspection, injuries went down almost 10%. So very similar to the Pennsylvania study. They reduced workers' compensation costs for the employer, and they actually measured it. They looked at what they did. They said there was a 26% reduction in workers' comp costs, and they measured the impact. They estimated that each inspection saved the employer, each employer, $350,000. It didn't cost them money, it saved them money, with no effect on the health of the employer. You know, it didn't impact jobs. You know, they didn't do more jobs or less jobs, but no impact on sales, creditworthiness. They tried to pick every measure they could of the health of the company. Yes?
Just I guess a quick question, because California they do their state plan.
Yeah, it's
so
yeah.
Are they thinking about doing a study, you know, maybe more nationwide, since Cal OSHA has more stringent?
Well, no. For safety, it really has the same rules. The reason they could do this in California is they had access to the workers' compensation system. See, we have no national workers' compensation system except for us, for federal workers. So to actually get information about the outcome you want, which is injuries, you have to go to the state. So there have been 3 studies now, one in Pennsylvania, one in Washington, one in California, all finding almost the same thing, using state workers' compensation data. But that's the key. You have to do it on the state level. So they got California OSHA data, but they actually got the data from us because we collect everything, because they're all part of our system. Anyway, so that's the evaluation of enforcement. So the other thing we try to do is we try to do public campaigns, because we know we can't reach anybody just through enforcement or through standards or consultation. We want to reach workers as well. These first 3 things we talked about are really aimed primarily at employers. But we want to reach workers as well, but we also want to reach employers. So we decided to take on the, you know, I realize I'm spending lots of time talking here. I don't have am I good on time? Okay, well.
Maybe what we'll do is just kind of contain questions
Well,
at the end.
yeah. You know, after the Deepwater Horizon, when the Deepwater Horizon exploded 3 years ago last week, killed 11 workers, sent millions of gallons of oil heading toward the shores of the southern states, Gulf states, we mobilized very quickly. We worked closely with EPA, a number of other government agencies, and we recognized pretty quickly that in the cleanup, we thought the biggest hazard was going to be heat. We expected, and we actually saw once we started measuring, that by the time the oil got to the shores of Louisiana, Alabama, Mississippi, most of the volatiles would have been evaporated off. But you've got workers cleaning up the oil in June and July in Louisiana. We insisted, the government insisted, that BP hire local workers, local people who are displaced from their jobs because of the economic impact of the oil spill. So they hired workers who were not cleanup workers necessarily, and they weren't healthy young men. They were often older, hypertensive smokers, overweight. And we thought, this is a recipe for disaster. You have tens of thousands of workers out there every day in the sun, on the beach. There's no shade. And so we looked at what the military does in Afghanistan and Iraq with young soldiers, and we have a heat work matrix. And based on the relative temperature and humidity, if you're in Afghanistan and you're working outside, depending on this index, you can work 30 minutes on, 30 minutes off, 40 minutes on, 20 minutes off. There are situations where you work 20 minutes, and for 40 minutes you rest and rehydrate, if it's hot enough and humid enough. And we said to BP, actually the Coast Guard said, we said to the Coast Guard, and the Coast Guard said to BP, follow this matrix. And BP said, sure. We're very fortunate that BP was so amenable to this, because many employers wouldn't have, because they were paying for people essentially not to work for certain periods of time. But we told them this is the way to ensure that no one's going to be killed. Because every year dozens of workers are killed outside in hot weather, and BP followed it. We had no fatalities, and it was very successful. We had several hundred cases of people who had symptoms of heat, not surprisingly, and 1 or 2 hospitalizations, but we had no fatalities at all. It was very successful. And we said, well, it worked there, let's take it on the road. And while we can't force any employer to do this, we said, let's talk about heat. And let's talk about for agriculture workers, construction workers, because we know the summers are hot and the summers are getting hotter. So we started a campaign. It's a very simple campaign where it's sort of framed in 3 words: water, rest, and shade. That's what you need to know. So we put together some materials, actually a lot of help from Cal OSHA that started this a year before us, in English, in Spanish, a lot of pictograms, posters. There. We started working with the National Weather Service that every time now that they issue a heat alert, and it's been true now for more than 2 years, they say OSHA recommends scheduling frequent rest breaks in shaded or air-conditioned environments. Anyone overcome by heat should be moved to a cool area. Call heat stroke's a problem, call 911. So that has gone out thousands and thousands of times. We have a great, what we call a heat safety tool. It's on Android and iPhone in English and Spanish. And if you know the temperature and humidity, it will calculate. But it also will use GPS, and based on where you are, it will tell you what the level is, if it's low, medium, high risk, and what you should do at each point. It's been downloaded before this. We haven't cranked it up this summer, but we've got about 60,000 downloads, which for a government app is pretty good. We got an award from this Association of Marketing and Communication. I thought, well, big deal. We got this platinum award. Turns out the other people who got this platinum award was the Aflac Duck and the marketing, the Jeopardy game, where the Jeopardy series where he played Watson, the computer played against. It was considered there were only 2 government agencies that got this award that year. And it really has gotten out there. And what's been good for us is it also says OSHA cares about workers and cares about employers. We're not just doing inspections. We're not, we'll go out in situations where workers are complained to us and said they have to work without breaks, or in cases where workers are killed. But we really want to just get this out, and we want workers to be able to show their form and say, look, OSHA says we should be taking breaks. And that's why we have this, because many workers have smartphones. We put it all together in, in sort of one package for many hazards. We deal with grain handling. We've known for many years that if you go into one of these grain facilities that's filled with corn or beans, or anything, if you go in there and go on the top of it because the grain has hardened and try to break it up, if you fall into it, you can be engulfed and suffocated in seconds. And every year we do lose dozens of people to that. 2 summers ago, we had a very, very wet summer. The grain was particularly moist, and therefore it then caked up. And so you had situations like this. This is 2 young men, actually 3 young men were in a small town in Illinois, were asked to go in and break up the corn in one of these silos, and someone opened up the bottom so to have the grain to begin to flow out, and they were engulfed. 2 of them died, 1 survived. It was heartbreaking. One was 14 years old, the other was 19, and there was a 20-year-old who survived just by holding his head up and holding the hand of one of the other ones. And they were saying the Lord's Prayer as one of them died. It totally broke our hearts. I mean, we're just distraught. Because in the weeks before that, we issued several 6-figure citations against other employers who'd done the same thing where workers had killed. And we said, we're not getting the message out. So and you could see what was going on that summer. This is Purdue University is the people who follow this, and they said this was the highest number of grain entrapments on record. So we stepped up. We announced we were doing more enforcement, but it's a little bit of a fiction in that, I think I read there are 800 grain silos in Kansas, and we probably go to 20 of them. So if we double enforcement, it means we go to 40 of them. So we talk a lot about enforcement. We make a very big deal of it because we know that employers often can't really calculate what the risk is of actual inspection, and we say it's much more likely it'll be inspected, and that's true. But we also worked with the industry to make PSAs and wallet cards, fact sheets. We went on the radio. I sent a letter. We wrote a letter which we sent out to thousands of grain handling facilities across the country saying, this is what's happening. There are some common sense rules you have to follow. It's against the law to send someone in without a harness and a plan. And we think it had an impact. The next year, entrapments dropped almost 50%. Now, we still had fatalities. And in one case, our inspectors told me that they rushed in and they saw my letter taped to the wall. So it's not one thing is going to work. And so we think we have to sort of the all the above strategy in some cases where we really think there's a crisis. We do a lot on worker rights because we think workers play an important role in protecting themselves, and the workers we're most concerned about are immigrant workers, non-English speaking workers. In other words, there are vulnerable workers in the United States who get the worst jobs, who don't know what their rights are, often hired by employers who don't really care as much because they hire them from a line outside Home Depot, and if they're injured, they dump them off at the emergency room, and the worker doesn't even know who their employer was. So we try to get out to workers in various different ways. We had a huge meeting, a summit in Houston a couple years ago. We were surprised. We had over 1,000 people. We had turned people away just focusing on Latino worker health and safety with some just remarkable stories about what people were going through. We then started doing regional meetings and local meetings at churches often, just telling workers, come talk to OSHA. We want to talk about some of the hazards you face. We did them in Spanish. We also worked with Asian American Pacific Islanders in the West Coast and New York doing programs in Chinese and Vietnamese. One thing we're very proud of, we signed agreements, alliances with consulates for all these Latin American countries and the Philippines. If you're a worker from Guatemala in Arkansas and you're afraid to call OSHA, we know the consular general now in Little Rock very well. He tells Guatemalan workers who come into the consulate, if you need help with OSHA, he'll make the call without giving us their name. They can get materials about OSHA from the Guatemalan consulate. That's true for the Brazilian consulate in Providence and Boston, where there are a lot of Brazilians and Portuguese-speaking people work. We try to cover as many countries as we can, getting information out, because the law, as I said, is if you're working in the United States, whatever your status, you're covered by OSHA. We have a memo that we put out to our staff, which then is really, it's a memo to the employer saying that training for workplace safety has to be done in a language and vocabulary that workers understand. I mean, it seems fairly obvious, but we've been in situations where we go in and said, why wasn't this worker trained to operate this machine safely? He said, well, they don't speak English. How can I train them? And our position is if you're going to hire someone to do a job, you have to hire them to do the job safely. And you have to figure out how to train them, or if the training is required, then that's a violation of the law. And this came in the wrong order, sorry. We're very much concerned about temporary workers because we know that's a group of very vulnerable workers. They're workers who are afraid to make complaints because they need the income, and they're often not even being paid directly by the employer, but being paid by a staffing agency, and they show up at the job and they're told to do something. And those workers are at much greater risk of injury. We've always known that new workers, no matter what their age, new workers are at greater risk because they don't know necessarily the hazards of the job. They haven't been well trained. Well, if you're an employer and you're bringing someone in for a week or two or even a month, are you going to put the resources into training them? Well, we say you have to provide a safe workplace to all workers, not just your permanent workers. Every worker has that same right. And there's more and more temporary workers used all the time. We've seen too many what we call first-day fatalities. In this case, a young man, 21 years old, 22 years old, was sent by a temp agency to the Bacardi bottling company in Jacksonville, and he was told, this is a palletizer, go in and get the glass. You can't really see the glass. Go in there and clean that out. Even though it says danger, do not enter. It's your first day on the job, you're a temp, and the foreman says, go do that job. You're going to say no? He went in there, someone turned the machine on, and his first day at the job was his last day on earth. And I can't tell you how many first days fatalities we've seen. So we have a very strong position that all workers deserve protection. Actually, this Sunday is Workers' Memorial Day. It's the day that we attempt to commemorate people who've died on the job. And Monday, we're having a big event at the Department of Labor, and we're going to really focus on temporary workers and some of the hazards they face. We're also very concerned about incentive programs, and this is really the way you think about this. There's a lot of employers who have programs that provide benefits if workers aren't injured. And we're concerned that those benefits actually end up discouraging injured workers from reporting their injuries to their employer. And if an injury is not reported, it can't be investigated, and you can't learn anything to prevent future injuries. So there are often these safety bingo games. If no one in the group is injured, then they get to play the safety bingo, or they're eligible for a lottery type thing, often for something good. Sometimes it's just, it's a pizza. Everybody. If no one's injured, we've heard, when we had our Latino summit, we actually were told by the workers at the hotel that their policy there is if no one's injured, that everyone gets to share a pizza at the end of the week. But you could imagine what the impact that is on worker injury reporting. And the most extreme example we heard was a gas drilling rig in New Mexico, where workers were told if no one's injured for 3 months, everyone gets a month's bonus. So you're injured, let's say you got some laceration, 8 weeks into it, 9 weeks into it, and you're looking around saying, if I report this, it's not just me who's not going to get the bonus, but all of these other people. What are you going to do? So we discourage these programs. We think if a program primarily consists of awarding benefits to workers who don't report injuries, that program's flawed. And we tell companies now they can't be in our VPP program if they have that policy. And a lot of employers recognize that, have changed it. Some have dropped out of the program. We think there are a lot of things you can incentivize. And incentives are not a bad thing. We understand psychology. And you can incentivize training. You can incentivize hazard abatement. There are lots of great things you can do. But just incentivizing no injuries really incentivizes not reporting injuries. So we will investigate under several different laws if workers are discouraged from reporting injuries, if they're disciplined no matter what the circumstances of the injury. We often see situations where someone is injured and then they're brought up, we look at it as no fault at all, and they are disciplined. Invoking otherwise ignored safety rules, we've seen situations first where 6 workers will be doing something, 1 is injured and they're disciplined, or a worker is disciplined after getting injured for lack of situational awareness. They weren't paying attention. If you don't discipline people for that same cause when they're not injured, if you only use it when you're injured, then it's really meant to discourage injury reporting. Offering incentives for not reporting injuries, obviously, we've talked about that. We also think it's extremely important that workers know that they have the right to call OSHA, and they shouldn't be in a situation where that's discouraging. The law is very clear about that. In one case in New Jersey, at an oil company, we had an anonymous complaint. We actually didn't know who sent in the complaint, but we inspected, we issued citations. We actually, even before we issued citations, but the OSHA inspection triggered an employee being fired. And that employee came to us and said, look, they're claiming I made the call to you, and I was fired. That's a violation of the law. We found for the worker, we said the company had to pay $7,500 in back wages. The company refused, and federal marshals seized the black Corvette of the president of the company. We thought that was a great example. We like to talk about that, because that got a lot of press in New Jersey, and also it sort of personalizes it. But we have, one of the things OSHA does, and this actually relates to PHMSA, is not only do we enforce the anti-retaliation provisions of the OSHA law, but we actually have 21 other statutes, including pipeline safety, where if a worker raises a concern to the employer, to a federal agency like PHMSA, and is retaliated against in any way at all, including being taken off a list to get Saturdays off, or being taken off a list to get overtime, that's retaliation for raising a safety concern. It's against the law, and OSHA is given the responsibility to investigate. So we cover many statutes, including many DOT statutes, but pipeline safety is one of them, but we do clean air, clean water, surface transportation, but we also do Sarbanes-Oxley, because as you know, there was an Enron whistleblower who, if she had been listened to, if she was able to raise these concerns, a lot of people might not have lost their pensions as a result of that. Food safety modernization. If you, Congress, in its wisdom, recognized that if workers are in a workplace where they're making food and adulterated food is being packaged for sale or things like that, if workers should be protected to be able to raise those concerns. So OSHA gets all of that. So we have a large, actually a very small, but growing whistleblower program. We have about 110 inspectors for the whole country for 22 statutes, but we're really trying to increase it. In the president's budget, he asked for 47 new inspectors. I don't know of any other department where there's like a more than 40% request for an increase, because we're such a small unit. But I think we're doing a great job. We have a bunch of regulations. I'm not going to talk about those. The best thing, and we work very closely with the Federal Railroad Administration here, is around railroad workers. For many years, some railroads have had programs that we look at as discouraging workers from reporting injuries. Railroads valued low injury rates. There was a big contest, the Averill Harriman Award, given by the American Railroad Association or something like that, to the railroad with the lowest injury rate. And we were getting report after report, in fact, hundreds of complaints that workers would be injured and they'd be brought up on charges. And we had cases where you had a worker with 35 years of not an injury, blacked out, and then reported the injury to, blacked out, hit their head, reported the injury to, in this case, I can't remember which railroad that was. And one thing led to another, and they were fired. We investigated. We thought this is totally a pretext. And we issued a finding, and our findings aren't binding, but they're the start of a process, and over $100,000 in fines. And we've done that many times now against BNSF, Norfolk Southern, because we found this policy. We're very pleased the railroad industry has dropped the Averill Harriman Award after 85 years or something. They've retired the award. They recognized that it was a bad thing. But BNSF has come to us and voluntarily changed all their policies. And they recognized, and they told me that it was because we explained to them what their policies were doing in terms of reporting. And they were very honorable. And we settled a bunch of cases with them, and we're hoping other railroads do the same thing. And we have a very close tie with the Federal Railroad Administration on this. And we'll work with any agency to help make sure these anti-retaliation laws are well enforced. The final thing I want to talk about, and this is really something I know you've thought about this a lot, is we want to move all employers away from a compliance culture to a safety management culture, culture of safety. And essentially, we think having a risk-based safety management system is what employers should have. So we've been calling that injury and illness prevention program. We have a lot of materials. We spend a lot of time convincing employers that this is the way to go. We get a lot of pushback. It's very interesting, and this is sort of the political side of the discussion. I'm a political appointee. I can talk about that. People really feel like, there are people who viscerally think OSHA shouldn't be allowed to do anything. Everything should be voluntary. And we say voluntary works for employers who want to do it, but it's everybody else who we're concerned about. but when we start talking about a standard, there's a whole chorus of people who say, this is terrible, the world's going to end. So I tried to say, what's the essence of injury and illness prevention program? So this, I thought, this is not my quote, but this is an injury and illness program regulation. It's regulation now, remember, would require employers to have an ongoing investigative preventive process in place instead of being reactive and addressing problems after an accident occurs. Now, I have a kid who's going to be entering the workforce relatively soon. And I think about, well, do I want my son to go to a workplace where they have an ongoing investigative preventive process in place, or do I want him to go work in a place where there's a reactive and they address problems after an accident occurs? It's pretty obvious to me, and I think everybody would agree, right? I mean, this is not exactly controversial. Well, this actually was a statement from one of the attorneys who's opposing us, saying why this is a terrible idea. I mean, it's fascinating to me because I think OSHA has so clouded people's minds, this idea that OSHA is this big bad agency, that anything we do is a bad idea. So this is from the Nation's Restaurant News, and this Matt Deffenbach is one of these attorneys who's on the other side of the table from us, who will oppose us when we issue this proposal. But that's his description of injury and illness prevention program. So we must be on the right track. If even the people who don't like us describe it the same way we do. And so we're moving forward. We work very closely with the Department of Defense. And whatever issues we have with our budget is getting smaller like everybody else, our commitment is to helping the Department of Defense ensure that both uniformed and civilian workers are safe on our bases. And we've worked very closely with them. And they've seen dramatic drops in their injury rates since they've really started to develop safety and health management systems. And we're very proud of that. There are many states that have recognized that a safety and health management system and injury and illness prevention program would be effective. And these states either have required or voluntary programs, or actually some sort of required program. California, Washington, and Oregon have had this requirement for decades, and employers there do fine with it. So we want to essentially bring this to the whole country. There's actually a pretty good study. The RAND Corporation went in there and they looked at what happens if you require injury and illness prevention programs. It's the most frequently cited standard in California. It's because they don't have certain standards. They actually have weaker standards in many cases than we do, and they have no general duty clause. So they use injury and illness prevention program all the time. What RAND did was they looked at companies where OSHA cited for lack of injury and illness prevention program. Did it reduce injuries? Really, it says illness, but really, did it reduce injuries the following year? So often what happens is the inspector comes in and says, where's your program? And it's a written program. If you don't have it, they give you a $130 fine and they leave. And then what the employer does is they download something from the web. It's written, they sign it, and then they have it. If that citation occurs, what's the impact next year, the following year? What do you think? There's no impact because nothing's really changed at the workplace. They've paid a $130 fine, they have a written program, and that's the end of it. However, if they have something of a program, they say they have a program, but they're not doing something that's required, like they're not doing training, or they're not doing hazard assessment. And these are all the components, and they're very similar. I know you all are thinking about these same things. We say you have to do some hazard assessment, you have to do some training, you've got to do some follow-up, things like that. If they were cited for not doing specific things within them, it had an impact. In fact, those companies had 26% reduction in injuries next year. So that's a huge impact. And training, I think, if they were cited for lack of training, they had a 44% reduction of injuries. So we know it works if you actually do it. I tell people it's like condoms. They don't work if they're in the drawer. You have to apply them, and they're effective. I come from a public health background, so I used to use that line when I used to teach all the time. So let me end with Mort Korn, who was the Ford administration. He was the third assistant secretary for OSHA. He was actually the first public health professional who was a assistant secretary. And he reviewed sort of OSHA, and he said, this was right after the law was passed, that OSHA was an instrument of a revolutionary law. I always looked upon it as ensuring Americans have a new right to the Bill of Rights, the right to a safe and healthful workplace. And I'm very proud to be head of an organization that tries to make sure that that's really the case. So we could take some questions, and I hope this was useful.